The College of Education has a number of graduate programs in mental health. It's been a focus of the college for a long time. During COVID, the additional stresses on mental health and the issues around the country really became kitchen table conversations for the first time, and we were well positioned at that time to provide services and additional help around the state in mental health. So working with the State Department of Ed, we developed a center to address the problem in our state.
The key objective of the Scanlan Center is to serve as the state's hub for school-based mental health services. And so with that, we are really aiming to improve the social, emotional, behavioral, and psychological outcomes of both students and educators across the state. We do that through a variety of ways. We have professional development, research, we do training of graduate students in mental health professions, and we also offer clinical services statewide. Well-being, whether that's mental health, social, emotional, behavioral well-being, goes hand in hand with academic well-being, meaning how students feel about themselves, how they interact with other students and adults in the classroom, how they behave, is going to ultimately impact their education. And so if we want them to succeed academically, we also have to support their social, emotional, behavioral, and psychological well-being.
A couple of our key clinical services at the Scanlan Center for School Mental Health Clinic are short-term individual and group therapy that we provide to the K-12 population of students as well as educators, and then offering post-crisis debriefing and support, so we're able to go into schools following a crisis event, work with the crisis team that's on site to provide some ongoing support to the school staff and the students. In September, our clinic officially opened, and since that time, we've been able to connect with a number of school districts and area education agencies around the state, really to develop those relationships, help them understand what we can provide so that they can feel comfortable making referrals to our clinic. And we've seen a recent uptick in services since we've started making those connections, and in particular, interest around individual counseling as well as group counseling services.
We have seen kind of a downturn in mental health. Everyone talks about mental health as sort of like being worse now than it ever has been. And that's true and not true. So if you look at the popular media, they will sort of tell you like everyone's more depressed and they're more anxious than they've ever been. And we have to remind people that those are diagnostic terms. And what we'd find out if we really look into the data is that students, staff, faculty, employees, everyone's a little more emotional, a little more stressed out. One of the nice things that Scanlan is getting the opportunity to do is to sort of get into the conversation and talk to folks about gauging the emotionality on campus so that we don't see everything as either distress or crisis, that everyone's depressed and anxious. Well, that may not be true. People just may be much more stressed out than they've been because the world is stressful. And so being able to help sort of gauge that conversation, help settle everybody down. And so it's been cool to be part of that conversation.
What we hear over and over from the field is that not only that we're having trouble graduating teachers and school counselors and getting them in the school, is we're having trouble retaining them. So we know that the first 2-3 years are a critical period for educators and school mental health professionals in the schools. So getting them the training, sort of what is cutting edge, what works best, and getting them that armor. So when they walk into the classroom, they feel like, you know, I've got this, I know what to do. I feel pretty well supported and I've got the skills I need. Imagine Iowa, the Iowa School Mental Health Intervention. It's a curriculum for teachers to gain mental health awareness skills so they're able to identify issues as they come up with students, but also have the skills to address them and then to refer them to professionals if they need additional assistance. So we're hoping that they have the resources they need to feel like they have the skills to talk to a kid that has a mental health concern, and they feel confident that when they engage that conversation, they have the skills to be able to refer them on and to be there, to be a support for them.
As a workforce expansion trainee, it's a really unique opportunity for me to have what I consider like a co-curricular opportunity to understand what school mental health is, how to promote it in my future profession or future work, but then also how to address the needs of the current mental health crisis in America. The coolest thing that I've done in this center, I think, is being able to provide consultation alongside clinic staff to school counselors in the state of Iowa. So they were questioning, like, how do they walk out this thing called school mental health, and what should they do as school counselors to implement it or integrate it? And so we basically provided consultation around evidence-based therapy modalities and how they can integrate those in their day-to-day work as school counselors.
The learning and training opportunities in the center are abundant. We try to really approach it in a way that we can deliver professional development across the state of Iowa, which is super important to us because we're a very rural state. The Iowa Best Summit is an exceptional opportunity for educators across the state of Iowa. We have about 90 plus different sessions for educators to choose from to meet your own professional development needs. There's also different training opportunities, and there's also different pilot programs that we are doing with educators that are tied to research, particularly in the realm of school mental health.
By better training our current and future teachers to recognize the symptoms of mental health issues, to help them learn how to promote the development of positive social emotional skills and coping, that over time we'll see a reduction in the mental health impacts in our schools, so improved learning outcomes, less distress, less dropout in our schools. Those are long-term goals for the work of the center.